One of the main questions that doctors always ask me is, really, is this worth the money? My answer immediately is yes. In my office, I'm the numbers guy. I run reports every day. Even when I go on vacation, I have to know how the office is doing. And this has been the best thing that's ever happened to our office from a financial standpoint. What we did is we sent out a little, 1 or 2 page thing on what we did to these people. And now we have doctors, we have neurologists, we have people from Yale New Haven Hospital emergency room sending us patients. So we have, it kind of builds as you go. And we get referrals from other dentists as well. We get referrals from oral surgeons. In the past, we never really wanted to tackle jaw joint pain, headaches. You're not trained to do that as a dentist. But now we have oral surgeons sending patients to us, and that's pretty fulfilling. I don't want to oversimplify it, but if you build it, they will come. Once you start doing this and you get comfortable doing it, everyone will find you out. My answer is always the same. If you do the things that they tell you to do, when you get back, you're going to start treating your friends, your family, your staff. Once you do that and you have a few cases and a few successes under your belt, it's literally just a number of weeks until you're actually treating patients. Once you get that first win, and that first win will probably be with one of your staff members, all you have to do is do a T-scan in everyone in your office. 8 out of 10 of them will have problems as far as their bite being imbalanced. And once you show them that you can help them, you've won your staff over, you feel comfortable, and you're off and running in just a few weeks. It really depends on the doctor. If you really follow the protocol and you go by the letter of the law and you go A to B to C just like they're telling you to do, there's no reason why you can't do this in just a few months. If you really want to institute these policies and procedures and do the things that you're supposed to do, you can make your investment back, I'll say a minimum of 6 months, but probably less than that. And my answer is absolutely not. Once you get a few successes under your belt and you believe in what you do, it comes across like that. If you believe in what you do, if you believe in what you say to patients, you come across as sincere and you know that you can help them, the battle's won. Oh, the company has absolutely supported us, no problem, no question about it. There is support from the company anytime I need it, from the top all the way down. I would tell you, yes, absolutely. This was a very thorough course. I left feeling like I could start immediately, absolutely. We paid the program off probably in 2 months, 60 days, give or take. We have no problems finding new patients. If you ask the questionnaires that they provide that are concise, that doesn't take long to do, you'll have at least 50% of the patients see who need therapy. It's not hard at all to get patients of record to agree to treatment. If the patient believes in you as their doctor and you feel confident, you'll close them every time. As far as the financial arrangements are concerned, we really try to have a fee-for-service practice. So we like our patients to pay up front. If they have medical insurance or dental insurance that would potentially pay for some of that, we'll try to get it. But we try to pretty much get paid up front. Our increase in production was pretty substantial. Once we got going, we pretty much paid the program off in the first couple months. From there, we went from just paying the program off to probably doing $30,000, $40,000, $50,000 a month. And that was pretty easy to do. The most we've done in a month using this program is $80,000. We are not in an affluent area whatsoever. We're absolutely in a blue-collar town. Our office is right next to a bus stop. It's very easy for patients to accept this care, and I tell you why. First of all, they believe that I believe what I'm doing. They can see in black and white when they have the T-scan, which is a bite force sensor that you put in their mouth. When they see their discrepancies in their bite, everything makes sense to them. It's easy. We do get referrals from healthcare professionals. One of my biggest wins was a patient that was referred from the Yale emergency room. They just didn't know what to do with the guy. So we do get referrals from different doctors. We get referrals from oral surgeons. It's funny how things have changed, because I used to send all these patients to the oral surgeons. Now they're starting to send them to me. After you balance the patient's bite, their bite will always be better. They will always be better from a neuromuscular standpoint. The headaches will always be better. You sometimes have to check on them at a hygiene visit. You may have to check on them once a year, but they'll always be better. I can say, since I've been treating patients using this program, I've had different degrees of success, but I will tell you, everybody's gotten better. I will tell you, 100% people get better. One of my biggest wins using this program, she's probably 38-year-old school teacher who was very stressed out. Beautiful lady, horrible headaches, migraine. She would be in a fetal position several times a month, probably go to the hospital once or twice a month for injections. Nothing made her better. And so she came to see us, and we put her into a 12-week migraine program, and almost immediately the migraines got better. So after the 12-week program that she went through, I don't think she's had a migraine in 6 months. Her family, every time they come to see me, we're the superstar. They say, "Thank you for giving my daughter back to me." I mean, it's just the best thing that I've ever done. One of the things that I learned using this program is you can really break it down into 3 things. Patients have problems with their teeth because of infections, because of acidity, and because of force. In the past, if someone came in with a lesion on their premolar or an abfraction, well, what do? Well, we know that there's a force issue. So now, using this program, I can put them on the T-scan, I can check these areas, I can see every single one of these areas on the premolars that have or the molars that have abfractions. They're also hitting very hard. I can put a quantitative number to that. The patient sees it. I put my intraoral camera and I show them up on the TV screen these areas where they have recession, and those are the same teeth that are hitting too hard. So I know exactly what to do. The patient feels like they're involved with what we're co-discovering this together, and we make it better. This is very easy for the staff. I will tell you, it's a very in-depth course. It requires some serious work, but after the 2 or 3 day course that you take, anybody can go back and institute this. My dental assistant, she's awesome. Patients come to these appointments, they love her. She's like the goddess with the golden hands. We've taken a number of CE classes in the past, both with soft tissue management, with peri, with lasers, a myriad of different courses. Some of them were difficult to implement when we got back. The difference with this program is our staff is involved from the beginning. So we bring our staff with us. Those that we can't bring, we teach what we've learned when we get back. But the staff absolutely feel like they're involved. They see that all these patients really need help. So when we get back, it's really instant. We can't wait to get back to institute these things and to try these new cool devices. This program will work in any office or any location, anywhere. It doesn't matter if you are Park Avenue, it doesn't matter if you are in the middle of nowhere. Most of the patients who you treat have an unbalanced bite, but you just never knew it before. Now you do. When we see a need to do a T-scan on somebody, when we see potential pathology, we know that they have an unbalanced bite. We show the patient the problems they have. We ask them the questionnaire. It's pretty black and white. If the patient gets it and you educate them, the vast majority say yes. The wonderful thing about this program, I think, is the patients get better, and it's also good for the pocketbook. I mean, the patients get better, number one, but it doesn't stink that you could afford to pay your staff as a result of this. One of the things that makes sense to me, my assistant pretty much does all the therapy. So my main assistant will be in my second room doing the therapy, and I'll be working in my first room doing a crown prep with the floater. So it works wonderful. The patient feels better from visit 1, and they feel better both physically and mentally, because I find that a lot of patients that come to see you, You're their last resort. They've been to every doctor, and half the doctors don't believe them. They come to see you, you take them seriously, and you're the only person that can help them. One of the things that I really like about this program is not all dentists are involved. We're almost like an exclusive group of people who have really taken occlusion to the next level. And it's not just occlusion, it's dental well-being. And not everybody can do that. Not everybody should do it. One of the things I really like about this program is, from a financial standpoint, I always want to put the patient first, and I always do put the patient first. I also find if I put the patient first, usually the money will follow. But from a money standpoint, this is the best thing I ever did. The 2 profit centers in my office that have been the best in almost 20 years of practice is our Panorex machine. In 12 years, we've done over $1 million in Panorexes, and the machine costs $30,000. It's a no-brainer. This is like that. We have the potential to make much more than that from a financial standpoint using this program. And the thing that's wonderful is everybody gets better. So it's not all about the money, but you'll feel good all the way to the bank. Obviously, if you're watching this, at some level you're thinking about whether you're going to do this or not. And I would tell you, I'm not a paid spokesman. I'm just someone who was asked to basically do a video because we've been very successful. There's no reason that you shouldn't do it. Just take the leap of heart, take the leap of faith, just do it. Someone starts experiencing jaw pain, TMJ. Some people come in and they just automatically say any kind of jaw pain is TMJ. They have problems with migraines. But in particular, if they come in and they're complaining about TMJ, one of the things they'll do, they'll go to their doctor. The first thing the physician will do is just medicate you. And that'll never work. And we know that. So now you have a drugged patient who still has pain. So then the patient will then go to the ear, nose, and throat doctor. The ear, nose, and throat doctor will probably put them on a different type of medicine and potentially give them antibiotics for a non-existing ear infection. When that doesn't work, they'll go to the neurologist. The neurologist will order all kinds of expensive tests. The patient still has pain. They can't figure every scan looks normal. The patient gets referred to the psychiatrist. The psychiatrist puts them on psychotropic drugs. The patient now thinks they're crazy, and they're still not better. They somehow find their way to me. Within 1 or 2 appointments, they're totally better. I'm the only one that can do that. There's no one else that can do it. I don't care how many letters you have after your name. I'm the guy that can fix it. Other dentists who don't do this, they're smart. They can't do what I do. As far as justifying the cost of the program, there are patients everywhere that need your help. There are patients, there are family members, there are staff members. Probably 80% of your patients that you have of record have a bite imbalance. But you just don't know what you don't know until you take this course. I will tell you that as far as this program is concerned, I'm not a paid endorser. I'm not a paid spokesman. I believe in what I'm saying. If there's ever any question about whether this stuff works, my cell phone is 203-494-5802. And my office number is 203-933-7135. You can call me, or you can call my staff and ask them firsthand. I will tell you, this is the best thing that I ever did. I have always thought that I'm a good dentist, that I had the skills, that I have, that I love my patients, that I really care about them. I was taught well in school. One of the things that I will tell you right now, in talking to a lot of different doctors, is basic occlusion is just not really taught well in dental school. There are maybe a few dental schools that teach occlusion well, but if you're watching this, you probably don't know, unless you've taken a lot of CE classes, as much occlusion as you should. And I was one of those. After doing this course, you realize absolutely, this course to me changed everything. This is the standard of care, or should be, in treating patients with occlusal problems, with any type of headache, TMJ. This should be the standard of care in dentistry. I will tell you, as a dentist, we're highly educated people. This, what I've learned since I became involved in doing these types of therapies, it has opened my eyes just to really everything. It's almost like there was Bill as a dentist before this program, and now there's me as a dentist after, and I'm much better as a result of this program. I did a residency at Medical College of Pennsylvania, and we rotated through University of Pennsylvania all the time. We had the best people, the best minds, and my residency was wonderful. I have learned more about the head and neck, about the teeth, about the neuromuscular function. I've learned more to just bring all the concepts that we were taught in dental school, and I've learned them in such a profound way that it's just changed how I practice. This really at some point will become the standard of care. And to me, you know, I was glad that I got involved when there were just a few people doing this. Probably one of my most rewarding cases was one of my first cases. This was probably a 55-year-old lady who had been to see every doctor that you could think of. She went to her physician. She went to another primary physician. The physician sent her to an ear, nose, and throat specialist. She was sent to another ear, nose, and throat specialist. She went to get acupuncture. She went to a naturopath. She went to a neurologist. This patient ended up going to 2 or 3 different psychiatrists as well. This patient was put on Paxil, Zoloft, so many psychotropic drugs. She still had the same issues, except not only did she have these issues, in her mind she felt like all of these doctors thought she was crazy because none of them ever believed her. They couldn't see anything on a scan, so there's nothing wrong with you. So she was on, when she presented to me, she was on all these medicines, and she was on Augmentin. She had bad diarrhea on top of it from the antibiotics. So we looked at her, and this was a patient of record. This is a patient I've known for years. This is a patient that, in retrospect, I should have looked at her years ago if I had this technology and said, you have a problem with your bite. I guess I didn't know at the time. But she was, I came back and I looked at her, and we documented everything. We put her on the T-scan, which shows where you bite and how much force is on what tooth or teeth. As soon as I put her on the T-scan, she lit up. She was like 80% on one side, 20% on the other side. She was hitting the back. She looked at me, and from the very first appointment, she was in tears, not because, she was in tears because I listened to her and I told her, I can get you better. So in 6 months of doctor shopping, I was the one guy that gave her hope. Really within 2 or 3 weeks, this lady was like her old self. You know, we made an occlusal device for her. It took me 10 minutes to make this device. She called me 2 days later, and I followed up with her. She was one of my first cases, so I really was hands-on with her. She would call me, and I could just document day 2, day 3, day 4. She just got better and better and better. And really, within the first week, she was a different person. I'm not a physician, so I can't say go off your psych meds, but I told her, go back to your psychiatrist. I don't think you need these meds. She did go back to the psychiatrist. She was taking off all these meds. She was weaned off the meds. And I would tell you that I saw her daughter several months later, and it was quite an experience for me because the daughter was almost in tears too. Thank you for giving my mom back. And geez, you just don't know what you'll get out of when you start treating patients where no one else can treat them but you, and you have such a big win with them. You change their life. You change your life. You know, I'll probably live longer because of patients like that.